One thing that I've noticed recently is that some of the old rules that I used to lecture on 25, 30 years ago to physicians are not as true today as perhaps they once were. For example, we still talk about the importance of communication and documentation, and those are consistent themes that are timeless. However, take communication. Even physicians who are good communicators, who have great bedside manner, I find that today they still may get sued, whereas years ago they really didn't. Statistically it was much less. I think the reason for that is that there's simply less time to build a relationship with patients. And consequently from that, the patient is often more comfortable in bringing a lawsuit if they think that is warranted.
One of the new trends we're seeing in recent years is more and more claims are brought against hospitals or institutions rather than just an individual physician or a small practice. This is due in part to the fact that today many physicians are employees of hospitals or institutions rather than just being in a standalone practice, and in part to the fact that plaintiffs' attorneys see institutions as a better defendant for their purposes at trial. They'd rather have the large, faceless corporation at the counsel table rather than the nice individual physician. It can be important for the physician to know that he or she has their own personal attorney to work with, because the hospital is usually going to have risk management expertise along with their own counsel, and sometimes there can be tension or even conflict between the individual physician and the institution. So it's good to consult with counsel, have separate counsel to work with, know who represents you, and help you through the process. Another trend we're seeing related to the current trend of suits primarily against hospitals and institutions is that individual physicians will commonly be deposed as a fact witness in their role as a treating physician for the patient who is now a plaintiff. So in many of these situations, we feel it's important for the physician to have counsel to work with and prepare for their deposition so they don't inadvertently become an expert for the plaintiff's case against the institution, or worse yet, become a defendant themselves in the case.